we have a topic and a guest, a special guest. Wow. If you're excited with me,
Yes.
yeah. All right. So we are going to talk about what I say. Let me see if I have that on there. Yes. So our topic is stay away, and it's an advice from an emergency room nurse. She's actually a specialist, a nurse specialist, and her name. If I have her picture here, her name
It's
is
not picture the real person.
the real person
Yeah.
actually now live in the studio today is Mrs. Henrietta Srebo Into. All right, emergency room nurse specialist, all the way from Ghana, who is visiting now, and she's going to do us the honors to talk about why people should stay away from the emergency room and why not if people should not. So we got a lot of things to talk about. I want you to share the stream and ensure that you show to somebody because some of the things she already opened my eyes to were wow. So I just want you to make sure you stay put and connected. And I will let her do a lot more of introduction because I don't want to say anything wrong. So I'm going to let Mrs. Henrietta Srebo. She's actually the wife of Dr. Srebo, who was on our show a couple of months ago. So that is why the name is familiar. All right, so I'm going to let you talk a
She
little
happened to
bit.
be my sister.
She happens to be the sister of my wife. She happens to be the sister
The
of Gifty.
younger sister.
Yeah, she comes after Gifty. So I have two wives in the studio. I know the husband is jealous right now. He's watching. Of two wives in the studio, and we all happen to be in healthcare. So I want to use this medium to help people out. So, Mrs., I want you to tell us a little more about yourself so that our audience will know what you do.
Yes, thank you very much for having me. As you already said, I'm Mrs. Henrietta Intosribo, and I'm a registered nurse and Bachelor of Science in Nursing as well. I'm a clinical nurse specialist majoring in emergency, and I've been in practice as an emergency nurse for the past 15 years. And currently, I'm doing Masters of Philosophy um, in the final year. So that's it.
Wow. That is an accomplished woman right there. Let's give her a big round of applause. You see, we have two likes for the show
Yeah.
because they actually like that we have you on. All right, so we want to go back to our side here. So we are going to our topic is stay away from the ER. And it's an advice that most nurses have. But being a nursing leader yourself, we think you should explain to us why people should stay away from the ER. So the first question to you basically is that why do you think anybody should stay away from the emergency room?
All right, thank you very much. Obviously, we can't stay totally away from the emergency room because nobody calls for emergency. Emergency do happen. That's why they are called emergencies. But there are some things that we can do as individuals to stay away from the emergency. So we talk about some of the preventive measures that we can do to stay away from the emergency. But obviously, you can't totally stay away from the emergency when you have an emergency. So, and from research, we have about 130 million people visiting the emergency room in a year. And one out of five people visiting the emergency room, or one to five adults visiting the emergency room within a year. So the emergency room has a lot of people coming in. So when you go in and it's not an emergency, you cause overcrowding in the emergency. You lead or you bring about increased waiting time for the other patients that are coming in. And when this happens, those who are critically ill come in and the resources are already taken. So it puts lots of stress on the resources that we have as well. So you can't totally stay away from the emergency, but there are preventive measures that you would do that would prevent you from coming to the emergency.
Really? So there's a way to stay out, and you can also chip in anytime if you want to add something. But then, since you mentioned, what are some of the preventative measures that we can do or we can take to avoid going to the ER?
Yes, so as individuals, we shouldn't forget to have proper diets and do our exercises so that we stay on top. And also, people who have prescribed medications with those chronic illness like hypertension, diabetes, you should stay on your regimen so that you don't end up with stroke that would end you up in emergency, or you end up with DKA, that is diabetic ketoacidosis, which is also an emergency. So there are things that we can do as individuals so that we don't end up in the emergency, and we can't talk without talking about the preventive immunizations that we can take. So now this is four, if I'm right, and the flu shot is available, and we have the pneumonia shots as well, and we can also talk about the COVID shots. So you can take these immunizations so that you don't end up in the emergency with some of these conditions. And then we can also talk about accidents that do occur that can be prevented. You know that when you drive, you shouldn't drink. So you should take that into consideration so that you don't end up having an accident that will end you up in the ER. So these are some of the things that you can do as preventive measures so that you stay away from the ER.
Wow, wow, wow. That is deep. But having said that, though, do you think there are other options? Because I mean, if you have to go to the ER, you have to go to the ER, right?
Yeah.
What other options apart from the ER then should we have?
So thinking, sometimes you might have minor injuries that might not necessarily like you don't have to end up in the ER. There are other options that you can take into consideration. We can talk about the urgent care. So when you have minor injuries like burns, sprains, strains, you can go for urgent care rather than going to the emergency to cause overcrowding there. So there are other measures that you can take apart from the emergency, especially with those minor injuries that we see.
Wow, 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 wow. All right.
Can you also consider like the how do we say
Telemedicine?
telemedicine? I think is becoming very popular of late. So if there is a little condition that you like you need attention right away, but to make an appointment with your PCP is going to take a little while. There are other things like apart from the urgent care, you can also reach out to the tele doctors that they are available now. We have some nurses that practice, some APRNs are also available online. You can do a little research and see if you can get care in that area. It's becoming very popular of late.
Yeah, so that's with the minor cases. But if there's an emergency, and I think we should talk about what there is an emergency, what we call an emergency. So with that one, you don't have any option than to jump into the emergency room.
Can you tell us some of those emergency situations that you think people
Yes,
should?
so there are some situations you need to run to the emergency as quickly as you can. So let's say you have chest pain. Chest pain is something that we don't joke with in the emergency. So before you can think about anything, in chest pain, you go to the emergency, EKG is run, other investigations are done, and then if it's not an MI, then maybe you are given some treatment and you go back. So some of these cases, you don't have to stay at home. Chest pain, shortness of breath, seizures, sudden collapse, sudden body weakness, loss of vision. We can talk about persistent vomiting or diarrhea. You don't need to stay at home. So these are some of them. There are a lot of them. So with those cases, you don't have anything to do than to move to the ER as quickly as you can. So those are some of the things that when you see, you have to run to the ER.
Wow, 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 wow.
That calls for
All right. So, if that is what you're saying, how can somebody really tell if this chest pain they are having is something that they should go to the ER for? Because some people get, let me see, right? Some people just get chest pain because of indigestion.
Yeah.
Some people also may have chest pain even due to anxiety because they are anxious about a situation and then they get chest palpitation. What would you say that is something that makes people that looks really serious that they should take to the ER? Or do you say that every chest pain, if you're not sure, should go to the ER?
Yes, be an ER nurse. Um, any ER nurse that hears chest pain has some tentacles raised. So the fact that it's chest pain, I would say you need to go to the emergency room, and then investigations could be done, and then it's proven that it could be just indigestion. You can go for your terms or some of your antacids and you get relief. It's better to seek for help than to stay at home and then face the own event for that you don't want to see. So I advise that if it's chest pain and there is room, just run to the emergency. Maybe on the way to the emergency, you can take your terms, then you go to the emergency and make sure it's the abdominal pain that you are thinking and not otherwise than to stay at home and then end up with
Something serious.
something serious that you can't do. So ERNS, chest pain, I don't joke with it.
All right, all right.
So I think what makes somebody that is having that symptoms wouldn't like to go to ER emergency room, because I know that sometimes when you go there, you sit and sit and sit and nobody will. The initial care, they'll come and take your stats. Then after that, you sit down for life. Like you can stay there for the whole day. So what are the criteria? What are the things that you use to measure somebody being attended to right away, or why you allow people to sit and wait for so long before they are attended to?
So that's very
That's
interesting.
very good
Very,
question.
very
Yes.
interesting. It's a good question.
That would be the
That's
reason why I wouldn't want to go, because I feel like when I
Waste a lot
go,
of time.
a lot of time is taken from me. So I'd rather do other things, take my time, just walk around and see how I feel before rushing to the emergency room.
so thank you. So when you come to the emergency room, we call something triaging. So we have a lot of patients there, but we use this triaging to sort out, to know the severity of injury or how critically ill the patient is. So based on your stats, your vital signs and all that put together, we place you at a level. So sometimes you see somebody just coming in and within seconds he's being seen and you are still waiting and your stats were taken about 30 minutes ago.
3 hours ago.
Yes. So obviously, it means that person needs emergent care than you. We are not saying that yours is not an emergency, but emergency comes in grace. So based on the level that you are, some of them they need to be seen immediately, else they are going to lose their lives. So people have to be tolerant when they come to the emergency. Not that people are jumping the queue, but based on the vital signs and the presentations put together, you'll be seen accordingly, or you'll be downgraded to lower grade, which you can wait for about 3 hours before you'll be seen.
So in that line, because I heard there was a story in New York, one of the hospitals in New York, that somebody went to the emergency room and they sat down, and by the time that they realized the person was dead in her seat. So like if the initial stats were taken, so what will make a person that has rushed to the emergency room sit in their chair and die in their chair? What would have gone wrong in such a situation?
That's quite unfortunate. That's what I would say. But usually that happens when there are no births. I don't know where I'm coming from. Sometimes you have about 15 patients sitting down to be seen. So they've been triaged, but there are no beds available. So they have to stay there, and sometimes they will start their IV medications and the rest. So if the nurses don't take care to go around to assess them because they've been triaged, there are no beds because their conditions are not as critical as those coming in. Because those who are more emergent are being seen, given the best more than them. So I think it's unfortunate, but they should be going around. So that's an unfortunate situation that happened. But I need to be going around to see how they are doing in the chair. So you don't just triage them and then you close your mind to them. So,
Because like as they wait, the case or the situation may worsen.
sure.
So they need to be taken care of or
Yes.
monitored closely,
Yes.
because they were not feeling fine. And that's the reason why they
they
went to
came
the
in
emergency
there.
room.
Yeah.
So they shouldn't be ignored. And that
Yes.
was a very unfortunate situation that happened.
Okay,
Yeah.
my question is still with the preventatives, um, because we are saying that people should not just show up for showing up sick, right, at the
Yep.
emergency room. What are some of the things that people should do in terms of taking care of themselves so that they won't end up in the emergency room? I don't know if you mentioned a few
I think you
earlier.
said it.
You mentioned some, right?
Some of the preventive measures that they have to take so that they
Yes.
don't end up in the. So I think I talked about exercise. I
Okay.
talked about physical exam. If you haven't said physical
Sky
exam
exam.
and checkups. So
Checkup.
Okay.
if you have a family history of cancer, diabetes, you want to do frequent checkups so that it could be detected and managed before you end up in the emergency room.
All right.
Yes. And
All
then
right.
I'm thinking you should be familiar with the operating system or the emergency operating system in the area that you find yourself so that you know how to go through emergency when it happens to you.
All right.
So with doing monitoring, I know that here in this country they have the annuals that is recommended for everybody to follow through. So you have to do your annual when you go. You make
The annual
sure
physical.
your annual physicals. You have to know your numbers. We had a show that we talked about knowing your height, your blood pressure level, your diabetes, your sugar levels, the basics. So if you know that every year you have to do this test, that's what you're monitoring. That's why you know that, oh, this year my numbers were like that, but the next year I have to go again. So you don't wait for something bad to happen to you before you emergency. You have to love your body. The spirit that we have lives in this body. So you have to talk about knowing your body, this is all that you got. So you have to take good care of your body. So if you ignore certain things, certain symptoms, you know that you're not really feeling well, you ignore it, it's going to catch up with you. And if you're not lucky that that emergency situation hit and there is nobody around you to
Yeah.
call for ambulance or 911, it may be too late. So just love your body, know the changes that are happening and follow through and just take care of yourself.
All
That will
right.
help you.
All right. Good. 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 Now, my before we switch to what the ER nurse, especially you being a leader, what you expect from patients when they come. Before we switch to that, and I still want to pick on your brain a little bit in terms of the services that are provided at the emergency room. I mean, when I saw topic stay away, I was like, oh, good, I'm not coming because you guys people come and wait. Now, you mentioned the triaging. Now, what are the real criteria? If somebody comes and you triage them, you find out that this person, it's just a minor stomach bug that is maybe. But why don't you then send them home? Why do you let the person sit and wait and wait and wait? Because their illness is not serious. They end up spending 5 hours. I mean, I've spent 5 hours in the ER before because obviously they thought it wasn't serious. But nobody told me go home, need be takes this, and I ended up staying there for all that long time. I understand now that you explained that you treat those critical conditions first before you see people. What can you do different, or can you justify that you don't tell me yours is just had to go home or take Tylenol, than to let me sit in the ER just because I've come? Is it because you want to charge money?
Interesting. I don't think so. In my part of the world, we have something that we call 100% compliance because it's a teaching hospital.
Okay.
And we have this problem with beds or shortage of beds, so no bed syndrome, sort of. So people do come in, you trash them, but there are no beds to put them on. And when you score a lower, when you are downgraded, it doesn't mean you are not going to be seen. You will be seen, but there might be other people, or it means that you don't need emergent care. So your care will come, just that it will delay. So it doesn't mean that you wouldn't be seen. So averagely, so in Ghana, we are using this color codes. We have the red. Red means be seen immediately.
Okay.
Then we have orange, you need to be seen within 10 minutes. So barring any difficulty, at least by 10-minute time, you will be seen. Then we have the yellow, that means you should be seen within 30 minutes. So that doesn't mean that when you go and the place is empty, you stay for 30 minutes before you see. So sometimes the downgrading, you will wait based on the number of people available in the ER. So if it's so crowded, it will take time for you to be seen. So in one way or the other, you will be seen, just that it will delay.
Okay.
And you can't just go home. This is not serious.
I don't know how you was in Ghana. It's a taboo to tell the person to go home.
I mean, they don't tell you to go home.
Yes,
That's
you
what I'm
can't
saying.
say that.
Oh.
You can't say go home.
Because
Either
if
you
something
tell the
happens-
person to go to a lower. So Ghana, we have the polyclinics.
Okay.
So you go that one, you go and join a queue because it's not an emergency.
Okay.
So you go and you are seen by the doctor. Just that it will take time. If it's an emergency and there are no, you tell the person to wait, or if he wants to go to another hospital, you give him the option.
Okay.
But
So
if
you
he
can
wants,
suggest it.
yes. But if you say you want that hospital, then you don't have anything to do than to make the person wait for him to be seen. And
Okay.
in some of our situations, people can stay for about 12 hours before they are
Yeah.
seen because the place is crowded.
And I think that sometimes people feel ignored though. So is it
Nobody
like
talks
a
about it.
time that somebody can explain this? Because I never knew that when I go to the emergency room, I'm coded. So like if in my mind I know that the first part has been taken and the nurse is saying that my situation is not that bad, maybe if I know, I will just walk away instead of wasting my 12 hours. Maybe you can't tell me because you're not supposed to say that. But in my mind, I'll be like, oh, it's not that a big deal. Maybe it's just, I just have to take time. So heartburn and I'll take something and it'll be okay. Do we have somebody like really educating
Yes.
us so that we know that we shouldn't use the ER for like little situations? It should be only for emergency situations.
Okay, so when it gets to the point, we have some EM patients around the triage area that can see to this minor cases at a point in time. So some of them are made to do X-rays and treatment given for them to go and come. Others are made to do EKG in the triaging area. And if it's not chest pain related to myocardial infarction, they are given the terms and they are made to go home.
Okay.
So depending on the situation, they do come into sort out. So the people don't stay there for longer periods of time.
Okay,
Yeah.
good to know.
All right. All right. Give me a pause right there. That's interesting. All right. So we want to see your comments. If you have any comments or any questions, you can throw it in there. If we don't see it, we'll be very quick to respond after the show.
We see one comments coming in.
Yes. So yes, we will proceed right now. And now the question, the big question: what do you, as an ER nurse, expect of patients or people who come to the emergency room? Do you have any? Because we have a lot of expectations. We want you
I
to be
know.
nice. We want you to be quick. We want you to take good care of us. We want you to make sure that you don't hurt us. Some of you do hurt us.
We don't want to feel ignored.
Feel ignored. We got a lot of expectations for nurses out there. But what do you expect of patients? Everybody who's watching, if we are going to an ER, what do you expect us to also do?
Okay, thank you. As an ER nurse, I expect my patients to be tolerant with us. And we know how the ER works. It's very fast paced, it's very chaotic with all the chaos going around. And then the nurse has to multitask as well. So patients or people coming to the year have to be patient with the nurse. It's because of them that we are there and we are ready to serve them. But at least they should give room for the emergency nurse because it's not easy working and thinking straight in those chaotic environments. So we expect them to be a bit tolerant to us and listen to us. We want them to respect us in one way or the other because we are also human. So immediately you are being disrespected, though it's your job, you get a bit frustrated in one way or the other. So we expect patient coming to us to be tolerant, should show us some respect. At least we also deserve that one. So obviously, and then we can talk about the patient coming in who has kept his personal hygiene. It's our job. We don't discriminate no matter the state that you find yourself. But at least it will be nice. You are being fair to the emergency because we're also human. That you come in with very good personal hygiene. We'll be delighted to also work with you. Even if you are unkempt, you don't have any option. That's what we are paid to do. But it will be nice to have patients who are kept, patients who are respectful, patients who are tolerant, so that we all move. It makes the work easier for everybody.
Wow, 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 wow. All right.
So how do you deal with or like disrespectful family member? The person that is demanding so much from you. You are talking about the place being in chaotic, and you are turning to more than how many people, how many patients, and you're running around. How do you deal with family members that want information and they are desperate and they are worried? How do you treat such a group of people?
Okay. We're supposed to treat them well. So imagine your family member being rushed to the emergency. They are not thinking straight anymore. They are stressed out, they are anxious. So their stressful situations are welcome because it's normal. So, but we have to find a way of dealing with the stress that they put on us. So, because they want to find out how their relative is doing. So, we sometimes inform the doctor, we inform the doctor to give the patient relative the history, where we are at that point in time, the treatment that he's given, what he should expect, and the outcome. Because when this is done, the relative anxiety level reduces and he becomes tolerant to you.
Okay.
And part of our job, the customer is always right. So you should have a way of dealing with your customer because at that stressful situation, you can't blame the family member that much because he's stressed with the situation that he find himself.
Wow, wow, wow. Now, talking about stress, let me ask you, how stressful is, well, before we go there, because I don't want us to. You mentioned that as part of the expectations, we should be respectful
Yeah.
of the nurses when we come to the ER, or at least the family members who come. And you also mentioned that keeping ourselves good. Now, would you say that that affects the delivery of care? If somebody is disrespectful, if somebody is not clean, they don't shave or they don't do, the personal hygiene is not there, does that affect your healthcare delivery, your service to the person?
No, it's a big no.
Okay.
It doesn't really affect the care that the person should have, or because the person is unkept doesn't mean the person shouldn't receive the optimum or the maximum care. It doesn't work that way. We give the best, but humanly, your feelings that you have and all that will go down. But you are expected, or we are expected to deliver to the maximum because that's what we signed for. But on the lighter note, or humanly, it will be nice, but it doesn't affect the care actually that we give to patients.
Wow, wow. Now, let's give a quick round of
Yeah,
applause.
it doesn't
One more time there, and then see that we are not taken care of because we are on care. I mean, it's good. Take good care of us. Do you want to?
Yeah, so I don't know because they are saying that I know some of the nurses. I don't know. I've heard that some of the nurses can be a little mean towards patients because of maybe the attitude of the patient. Maybe their pain medication may be delayed because the patient was rude or was not nice to them. So, do you get into trouble if, like, you find a nurse treating a patient that way? You being a leader, if you find out that somebody is not treating the patient as well as expected, is there consequences for not
Yeah.
treating the patient right?
Okay. So I would say that in any human institution, there will be some attitude which is untoward in one way or the other. doesn't mean that all nurses have very bad attitude towards patients. Like, let's say you are chewing a granite, only one granite or the whole you have in your mouth. So, in one way or the other, you may come across a nurse with very bad attitude toward patients. And if that is brought to the notice of the authority, actions are taken, actions is taken against them, and they receive their punishment. So, if only it comes to the notice of the supervisors, action is being taken on them. But it's not always that we have nurses with very bad attitude. At least we have one or two. You can't hold brief for anybody. Yes, but you have to face what you did or the consequences on your own. So attitudinally, fine. We have some badness among us.
All right, all right. We have a comment here right now. It's Rosina. So it says, great conversation. Thank you for saying that. I know other people are going to comment. But thanks. I know your sister, you wish you were here too, right? All right. All right. So now let's move on to the question that I had earlier. I could tell maybe it is stressful or not, but in your words, how stressful is your environment, the ER environment for you in a typical day? How bad is it? Stress.
The stress levels are high. I happen to work in the resuscitation area, and we are supposed to be taking about 8 patients. Sometimes we will end up with 17 patients. So you can imagine the stress levels. So sometimes it gets so stressful, really, really stressful for us. But that's what we sign for. So at a point in time, you can't say much. And as you are seeing your patient, new cases coming in, some of the patients will be having codes or there will be cardiac arrest that you need to multitask and then come back to what you are doing. So it's not easy being there, very stressful, but we are in. The adrenaline junkies, that's what we sign up for, but it's really stressful working in there.
How do you cope with the stresses? How do you cope?
Good
That's
question.
very good question. Very good question.
Coping strategies, right?
Yeah. How do you
So
do it?
the coping strategy, my coping strategy is when it's break time, at least I should have some 30 minutes break. So I cool off away from the resuscitation area just to free my mind a little before I come back. And sometimes too, looking at the results that you produce, although you are stressed, the joy that comes with saving somebody and the smiles on relative faces, at least you get consoled in one way or the other. So
That
though
makes
you are,
another
yes,
Yeah.
yes, yes. So I would say that's my anchor. It keeps me going
Yeah.
when I see the smiles on people's faces.
wow, wow, wow. That is you guys are doing a great job. You're doing a great job, and you do this for the most part of the week. If you work 5 days, you go to this level of stress 5 days a week. You know, it is a great job, and I'm happy you have a coping strategy because, as you can tell, stress is not good.
Yeah.
Prolonged stress is not good for you. So I'm happy you have a way of dealing with the stress. Now, that leads, unless you have something to add.
So will you introduce any person into your field, into your area?
To encourage
Do you
any
encourage,
newness.
yeah, or if there is a new nurse, what advice do you give to such a person? And do you encourage other people to take that role as a nurse?
Okay, so I first say service to mankind is service to God.
Let's
Another
give that another
applause.
applause.
That's my belief. And to advise someone going into emergency lesson, I think first of all you should have the passion to help the sick. So if you have the passion, that's what you eat. When you have your passion, you work more towards what you are doing and you don't really get frustrated because it's your passion, something that you love doing. So you should have the passion for seeing the sick. You should be someone who should be able to multitask. You should be smart. Emergency nurse should be smart
So
because sometimes
indirectly, you are smart.
I am. Because there are some things you should foresee before any other person can see.
Okay.
So you should be smart and emergency or ER is very fast paced. So you need to be smart. You should be more able to multitask. You should be able to think ahead and all that. So above all, you should be passionate about what you are doing. And that makes it easier for you to work in the ER. So it's not bad being there. It's not bad at all. I will say that for the past 15 years, it's been, it's interesting
Okay.
because every day you see different cases coming in. It's not like being at the bedside, so just one hypertension, diabetes. But when you're at the emergency room, every day you see something different.
It's like a
Some
maze. You understand
yet
what's going on with this
something
patient.
awkward, something
I've never
so you
seen
think is so
before.
upset. This one is so bizarre, but you see it in the emergency room. That makes it interesting there.
Interesting.
That is good. That is good. All right. So we are about to wrap up, but I got this question for you. What on a typical day, what would you say is a worst day? Today's a worst day for me. On a typical, I know that there's stress, especially in the healthcare system, there's stress everywhere. But on a typical day, what would you say today, as for today? And
Was
never-
just
yes. Think about it. Think about it as we move forward. It's not you gotta think a lot more to
yeah.
see that. The other question before we come to that is that when people are using the emergency room as against using the PCP, primary care physicians, what would you want to tell those people? Because there are some people, especially in the US, they will not see doctors, they won't make any appointment for anything. They wait until they are sick, then they show up at the emergency room. What advice do you have for them?
Yes, I would advise them to put a stop to it in one way or the other, because if you keep on jumping into the emergency room, your care will not be continuous. Because you see the emergency doctor, you are fine, you go home with no follow-ups. Let's say you had a high BP, you are given some medications, you go home, you are okay, you don't follow up. But if you are able to see your primary care physician, he will be able to follow you up, taper you down, or maybe taper you up as you go through the disease phase. So I think going to your primary care provider is the best option so that your care does not get truncated along the way. There will be continued care as you go along.
So would you also agree that such people are also using a lot of the healthcare resources because in the emergency room you spend more money?
Sure, obviously. And I read that when you in US, in Ghana, it's not that. In US, if you visit the emergency, it's not an emergency, you are made to pay double the price that you are supposed to pay. And at the end of the day, you are paying much more than you would have paid when primary physician. And also, you also cause overcrowding in the ER. You are going to increase the waiting time because you are adding up to the people who are working there or who are coming to see the doctor. Then we are going to stress the nurses and doctors in the ER unnecessarily. So I think looking or seeing your primary physician is a better option than jumping to the ER now and then. And we have the frequent visitors that we know. Because we have some, we know them. We have the frequent visitors, so we know they will every time they will come with seizures, either hysterical or whatever, they will be coming. So we have the frequent visitors that we do them. So everybody knows the frequent visitors. Yeah.
Wow.
So, what advice do you give them? Are they aware that they have to follow up with their primary care provider if they leave the ER, or they just have taken the ER to be the PCP center?
They are aware, they know very well what they are supposed to do. But sometimes it's the disease condition or the other.
Okay.
So when it comes to it, he gets attention in one way or the other. Everybody will be on her. She has seizures, and her seizures is the flying type. So she'll be flying, jumping out from the bed onto the floor. So everybody, so it looks like she's enjoying the attention that he's receiving. So you advise, psychologist has come in, she will still come. And obviously, when someone comes with seizures, you can't just tell the person to go away. You need to sit the person. So they are there. One or two people come in. Others do listen to your advice and then they go to the primary healthcare providers.
Wow.
Wow. Wow. Wow.
I think here in the United States, I think it's more like some people may not have insurance. That may be the reason why they won't have a PCP or follow up with care. So I don't know whether we have any advice for such people that do not have, first of all, documentation, or they don't have insurance. What do they do? Because they don't have the option. Their only time is they are in crisis. The only way out is to go to emergency room. So what resources do we have out there that we can put it across so that people can learn or follow
Well,
through?
I
Do you
think
know
I
of it?
think they do have options. Because there's this Catholic charity that provides bus. They actually go from neighborhood to neighborhood on specific days and provide people with primary care. See people every month. If you want to do it that way, that's people without documentation who cannot show anything, or people who have no insurance and are afraid of the cost at the ER and stuff like that. You can ask about it and you get free care, free medications, and everything like that. And some people do have insurance, but as I guess alluded to earlier, they would rather go to the ER than to take care of themselves instead of having regular visits to the doctor to deal with the disease condition. They don't take care of that. So anything happens, then they run to the. Some people are notorious for that. So no matter what, and I think there's also other insurance options there that may not necessarily mean you should have documentation. If you don't have documentation, you could still show up and as long as you pay your premiums, I think they'll take care of you.
So I
The
think
government ones, obviously, you
you
have
have
to.
to.
Yeah.
But like the state hospitals, they have to take you in
Yes.
without insurance. So just don't stay home thinking that because I don't have insurance, I don't want to take care of myself. You are eating, you are enjoying the life here. So you have to also use the resources that are available. I think when you go and they ask you of your insurance, all that you have to say is, I don't have insurance. And they have pay plan. They can cut the payments into maybe 12 months for you. Then you can pay what you afford. So don't use that as an excuse because you don't have insurance to stay away from your PCP. It's available, it's out there.
And
You
the
have to
cost,
do.
the cost to you, actually short, of going or staying home and getting sick and going to the ER, you will pay, like our sister said, maybe double.
Double.
And that time when you come with your bulldozers because it's a huge charge. Rather than to have some monthly payment to see a regular doctor who will take care of you and you don't get as sick to end up in the ER. And then the cost is also manageable, especially if you go up front and say that, I want a payment plan because I have no insurance.
So in Ghana, if you find yourself in the emergency without your insurance card or you don't have it, you'll be seen for 24 hours. So you get every services that you need for the first 24 hours because it's an emergency.
Okay.
And this thing can happen to anybody. Maybe you are traveling from one state to another and you are involved in road traffic accidents. And you don't have your insurance card with you because it's not connected nationwide. You still will be seen for the first 24 hours or so your relatives come. So there's something like that in Ghana. 24-hour care. Emergency cases.
Yeah, I thought everybody has insurance though. You have
No,
to sign up for, you have to
You have
buy.
to sign. You have
Okay.
to pay for the premium before you can enjoy the insurance.
Yeah, and also I know this place too. I know somebody had crisis at work and the person needed to be taken to the hospital. All that she kept saying is, don't call the ambulance, don't call the ambulance. Because I know that if you let the ambulance take you to the hospital, the charge and the cost that they will bring to you, it will be so high. So people are trying so hard to not to call the ambulance or call or get into the van to take them to the hospital because I know the cost is so high. So I don't know if it's an emergency, like you said, it's emergency.
Emergency is an
Emergency. So you have to use the resources that is available to you.
Yeah, because
So
there is only one life. So you need to take care of yourself. So you need to call the ambulance.
you have to call, regardless of the price or the cost.
You deal with the cost later.
Later.
You have to save your life 1st. We're about to wrap up. I want you to, I don't know if you
The
have
question.
any answer.
Oh,
And then
the
after
question.
That, after that, we'll give us your concluding remarks. We think about that too.
Okay.
If I don't give you all these questions, I will see you like what? Another whole year, 2 years before I see you again. All right, so you got to do that.
So Wednesday, right?
Yes. All right. So
Okay,
yes.
so
What is your
typical.
West typical West day
Oh, okay.
in
I
the
had
year?
one typical West day when there was mass accident, mass casualty, and we had patients being brought in from the peripheral hospitals. So we had lots of patients. We have to call for more hands to manage them in the resuscitation area. That was a very good day. And then at the end of the day, we ran many CPRs and we didn't get any survive at the end of the day. And so it was a very worst day, very hectic. At the end of the day, we couldn't say more. So that was my worst day in the year. And we closed very late for our normal schedule because we had to stay in and see to it that everything is fine. So it was we had a long day. The outcome wasn't as we expected, and so that was one typical Wednesday. The life of a year honest.
This is aching heart,
It
right?
can happen.
It's aching heart.
So the casualties, that was it like a bus, like a accident?
Yes, so there was head-on collision with two vans, and where I work is a referral center.
Okay.
So most of those who were badly injured were rushed in, and we have to go in and all that. So it was very bad situation. And you know, in Africa, the rate of road traffic accident is very very high. So that's the number one cases that we see in the year. Apart from the medical cases, we have plenty trauma patients coming in with head injury, traumatic amputations, um, chest injury. Yeah, you have to pass chest tubes and all that. So it's very hectic.
Wow. That is big. This like you said, this is God's work. And I'm sure one of the you forgot to mention one of the ways you deal with the stress is my brother.
Ah,
Because he
look at
was taking care
you.
of you. All right.
I
All
think
right.
somebody has a question.
Yeah, we have some comments and questions. The first one, I think Rose says, great conversation. And my brother, Bright, it's been a long time. I needed to call. I was just thinking about him, I think last week. I'm like, oh man, it's a long time. So, Bright, we need to talk to each other. And thanks for telling us that this is good. Oh, my brother is calling, Hold on. Let me see if I can talk to him. Doc, Doc.
Oh my God. Very good for telling you that he's part of the
All
stress
right.
control.
All right. I think I wish I could put it on speaker. All right, I'll convey your message. Thank you. All right. Your husband say he is a big stress reliever. I agree. I agree. All right. And you ladies can't do much without the men who are pillows in your life. You know what I'm saying? All right. Sometimes we use your pillows, but we are also pillows when you are stressed. So I'm happy he brought that up. Good. And also, we have Sister Rose again. It's a question. So in Ghana, if there is an emergency and there's no bed, what advice would you give to a patient?
All right.
So this applies to everywhere, not just anywhere at all. If somebody comes to the ER and as an ER nurse specialist, there's no bed, what do you tell them?
Yes. So when there is, no, it doesn't mean we don't see you. So as an ER nurse, anybody that comes in, you need to trash the person first. You can't say there is no, so I won't even charge you. So you trash the person. You know the level that the person is. Either he is critical, he is medium, or he's downgraded. And the next advice we give to the person is the place is full, we don't have beds. And then when we say we don't have beds, doesn't mean only bed, it means bed and resources. So the bed goes with the cardiac monitor, it goes with the nurse that will see the patient as well. So when you say no, but it doesn't mean there is no bed. It includes the oxygen you are going to receive, it includes the personnel that's going to see you as well. So you are given the option that either you go to another hospital. If you can't go or if you don't want to go, you are made to stay there until we have beds with you to give to you. It doesn't mean we wouldn't be seeing you. If we need to start something, we do start
While
something
you are sitting down.
where you are
waiting.
whilst you are sitting down. We start some treatment in one way or the other. If there is investigations that we have to do, we start the investigations as well.
All right, all right. So that's the answer for you, Rose, and that's a very important question. I give you an answer. All right, so we are wrapping up now. Well, we are almost 1 hour into the show. I want you to use this time, this few minutes we have, to give us your concluding remarks. Anything about that you want to say, you can go ahead and tell us. Unless, did you want to?
No, I think I'm good.
Okay. All right. Then you get the final word.
Okay, I would like to say that the ER nurse is a friend. It's because of you that we are there. But just remember that when you have an emergency is an emergency, you need to run to the ER because we are there to receive you. But we should also talk about the preventive aspect, the things that you can do that will not that will not end up you being in the ER or stay away from the ER. You need to take your regular checkups. You need to be taking your medications. You need to do physical examination, especially when you have a family history of hypertension, diabetes, cancer, and the rest. There are things that you can do. So the preventive aspect should be part of your daily life so that you don't end up in the ER. And one thing I want to add is when there is an emergency and you are sending your family member to the hospital, just remember to grab the medication that he or she is on so that it can hasten proceedings at the so that we don't start from the scratch. You are looking for the medication that the person is on and all that. So if you have the ability, grab the medication or we call something the medication list. You can grab that one. It makes the work easier for the ER nurse and the physician as well.
Wow. 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 Everybody go into nursing right now.
Have to change your major, right?
Your mentor right now. I mean, one of the things that she said that actually hit me was the fact that everything is different all the time, and I like the what do you call it? The idea of trying to find out what is going on with this patient.
Right.
You know that secrecy behind what you're trying to find. You know, and especially in an emergency situation. Hey, did you do this? Did you do that? And even though it brings stress, you got men at home.
So, like, you also said that the big one is the accidents, the
Yeah.
trauma that
Trauma.
keep coming. You know, the injury, the station, the test, and all that. So, are we thinking about ways and means to care for that, to look into that situation so that it doesn't happen that often? Because this accident thing
I mean,
is
that one is for the politicians.
is for the person.
So I remember at one point in time in Ghana, we were saying the road traffic accident
Yes.
is a pandemic for us even more than
Oh,
the COVID.
yes.
Yes.
More than
At a
COVID.
point, that was the conversation.
Yes.
And in all developing countries, India, you know, Pakistan, all those places, road accidents are killing people.
Yeah,
All right.
yeah.
We are about to close. I think we got another comment or question here. I'll bring it up and then we will read. So this is from Bright. It says, sometimes the behavior of some of our nurses are very poor. Kindly talk to our nurses concerning their attitude at work. And I think he needs an applause. Because I mean, I didn't want to say that much because you have told us the stress.
Right.
But I think he's got a point. There's sometimes I've heard that a lot of bad attitude nurses, and just to give you a contrast, I had a short procedure colonoscopy, and the nurses, it's like you can't even tell that they are not the doctors because the way they care, they are coming around you. Should I give you the drink? What time did you? It's so unique. So when we see that in other places, nurses are shouting and screaming at people. What do you have to say to that? And is there something that can be done? No, you are. I put you on the
Yes.
spot, but yeah.
Yes. I can't hold breath for everybody. And as I said earlier, it's a human institution. So for us to move forward, I think there should be tougher sanctions for nurses with those attitude. I think that's one way of solving them. And then sometimes everybody gets to the hospital. Every female in Ghana is a nurse. Maybe she's a receptionist. She is the orderly that cleans. Every woman there is a nurse, and every male is a doctor. So sometimes it's very difficult to distinguish if it's really a nurse. Though I agree that we have nurses with very poor attitude, and when you travel, you see the difference, and it's so much. So I think going forward, there should be tougher sanctions, and then people's conscience should be appealed to. Because I'm thinking that if you're able to touch the emotional aspect, that one day you can be a patient yourself. And it's like, do unto others what you like others to do unto you. So, apart from the sanctions, appealing to their conscience is also a way of dealing with this attitude. Very, very, very.
And I will also relay this to my brother, who is the president of the Ghana Medical Association. See if you can talk to the nursing association and do something about it, my bro, because it's everybody knows. And I think in your era, you could probably do something as in the line of what your wife is saying.
Can we also think of it in the nurses' perspective? Because, like, if they are overwhelmed, underpaid, overworked, sometimes the attitude will not just like action and reaction. Whatever they are getting, the reward that they are getting is so bad. So they are already
Always on the
angry
edge.
and they are not enjoying what they do. The stress, they don't have a way to cope. So maybe the only way is to scream or yell. So if they are thinking about ways or systems to set in place, maybe they can find ways and means, maybe increase their allowances, their pay a little bit, make it a little more rewarding, help them to be able to cope with their stresses. Because when you're stressed and frustrated with what you're doing, sometimes I heard a nurse saying that if there is no resources, nothing to use to take care of the patient,
Logistics.
and the patient is asking you questions after questions after questions, it gets to the nurse too. So we have to look at both sides. It's not only the nurses. What about the resources? The things
So I would say
that
that
are available
so
for the
with
nurses.
this question, I think the answer is multifactorial.
Yeah.
Yes.
So apart from the nurse not bringing out a very good attitude, we say a hungry man is an angry man. So when you are stabbed in one or the other, you'll be on the edge. When you don't know what you're going to eat at home, it puts you on the edge as well. So I think there should be a broader umbrella for this to be discussed so that
All right.
we can
So
come to.
I'm playing a DJ horn. So I'm going to put you on record. I want an appointment with you. We're going to talk about this topic, the attitude of nurses. Sometime later in the future, we can do this even if you're not in the US. So I'll hold you to that. And if you have other people you want to sit in, there's got to be a change because it's too much.
Yeah.
All right. And yes, we agree with what you're saying. View all women in the institution as nurses. And
Be a nurse.
so as long as it's a woman, and that also may have contributed to the overall blame. All right, so we are bringing the show to a close, and in conclusion, I think she said her conclusion, and we also want to add that if you don't need to go in the ER, don't. But if you do, please do. It's just as simple as that.
Stay at home.
Don't stay at home because it could mean your life, it could save your life right there. If you are not sure and something is happening, go. The whole point is not to discourage you from going. Listen to what your doctor tells you, and your nurse or whoever takes care of you. If they say call, call. Don't say that I watched the show and they were saying that nurses are too tired, we are bothering them. No, no, no,
Yes.
that's not what she's saying. We are saying that you have to go when you have to go. If you know it's not something that is important, then obviously you can deal with it. But if you are not sure, please go and listen to
And
the
stay at
advice of
home.
your healthcare provider. All right, so we want to express our profound appreciation and thanks to Mrs. Henrietta um, Cerebral,
Toes.
into cerebral, and an emergency room nurse specialist. She actually educates doctors too. She's a CE. Oh, there was one thing that I forgot. You volunteer with
Oh
Mercy
yeah.
Ship. Tell us a little bit as we
Oh,
wrap
that
up
was
here.
so interesting.
Yes.
I happened to be part of the medical capacity building in Senegal when the new Mercy ship called the Global Mercy docked there. So I happened to train about 25 in Senegal, did trainer of trainers for them on basic emergency care or how to manage the critically ill patients. In fact, it was interesting being on a ship. That was my first time, and giving care and teaching nurses as well was part of an achievement for me because I love to impact what I have learned to other nurses. So that was one good thing there for me.
Is it like a cruise ship?
It's a
Ah,
big ship, right?
it's a
Big
big
ship.
ship, messy, but it
Wow.
was beautiful.
Wow.
It was just beautiful being there.
Wow.
It's
I
interesting.
was talking with my brother, your husband. He said next time go for grace because we
Grace ship.
need money.
Money, no
No,
mercy.
no mercy.
Not just mercy, we need mercy, but we need money too. Not just volunteer. But that's just by the way, I just wanted to bring it up and say that our sister is also volunteering apart from her regular job. And as I was saying, she also teaches and continuing education training doctors and
Yes.
nurses in Ghana. So now we got a date. We are going to have you on the show again, and we'll talk about attitude of nurses. And the show may be ending, but you can still um, contribute because we are going to keep watching just to see what you have there for us. And going to answer more questions even at the end of the show. Next week, we are going to continue the live show. This was a break from what we wanted to do in October. We said that we are going to this month focus on just wealth and health, but we needed to break in and do this show. So next week we'll probably have a topic that deals with how money affects your health. So maybe if it's important, we look for more money as soon as possible because we may need it for our health. And we want to thank all those of you who watched and who contributed. Rose, Bride, Dr. Swebo, and anybody else whom we haven't been able to see yet on Facebook. We will respond to you. God bless you all. And we will say, beloved,
Beloved,
wish
wish
above
above
all
all
things
things
that
that
you
you
prosper
prosper
and
and
be
be
in
of
health,
health,
even
even
as
as
your
your
soul.
soul prospers.
Thank you.
Thank
And
you for
bye-bye.
watching.